know we have different people across the continent joining in. So the pleasure to meet all of you. My name is Kendi Muraino, and I'm dialing in from Nigeria. And I've been tasked to walk us through a bit of insight regarding career options or opportunities within international organizations, non-profit, non-governmental organizations. And I'll be sharing some of my insight and perspective regarding these career options and opportunities that exist within this space. Please kindly confirm if you can hear me. Is it clear enough?
We can hear you. I can hear you.
Fantastic. Thank you so much. So basically for me, I would not use a slide because typically when we are in very serious settings, we use slides. So I want us to have a chat, just have fun, but listen and gain, insight regarding the subjects of discuss. Now, the objective that I have here is just four. The very first one is that I will share with you what are contributions that exist within the international and NGO space as it relates to global health, right? And there's a reason why these organizations work within global health. They didn't just arrive at working in those spaces. There's a reason behind it. So I'll talk through what are the reasons why they work, and how they work. I'll also explain the career path that exists, the in-demand skills that you need to own and harness in order to successfully thrive within the non-governmental space. The third aspect I would like to talk about is that before you enter these organizations, you have to go through some recruitment process or application. So I will give you a glimpse into how it goes, what exists within that recruitment process, what you need to understand and pay attention to. The fourth aspect is what are the competencies you need to have fulfilling careers. So it's one thing to enter the space. It's another to grow and thrive because it's an interesting space. So I'll talk you through all of this. And we'll look at the pros and cons of working in this NGO space. So now as I move, I'll just talk through contributions that these international organizations or agencies make to health. So as we know, NGOs or international agencies play critical roles in advancing global health. So they work in low-income communities and they advance global health by providing funding. That's one. Two, technical expertise. And when I mean technical expertise, most people that work in this space are subject matter experts. So they bring forth those experience, those competencies to improve global health. They also help to shape and guide policy because before you can say a space or the sector is improved, there are policies that help shape projects, implementation of things, so they help to get and shape policies in the right direction. And finally, they also help play a critical role in implementing health programs. So when you hear rollback malaria, when you hear COVID-19, there are people, there are organizations that do this direct implementation in different countries, So I'll just say a few of their contributions. The first I've mentioned is funding. They have huge money. So these organizations, they tap into CSR of for-profit companies. And because for-profit companies don't really want to pay so much of tax, they do CSR. And so they take some percentage of their profit and give it to worthy causes. And this is where the likes of the World Health Organization will get their funding from a Gavi, a Global Fund, and that's how Global Fund gets that money and the likes and push it down to countries to implement projects. So funding is the critical contribution they put forth within the space. The other aspect I would like to talk about, I'll just glance through it, technical expertise. So they have experience in doing certain things and they bring forth, so think about health financing, health economics, economic evaluation, all of those technical expertise, they bring it forth into the projects, into the countries to improve the outcomes. They help with advocacy, awareness, so thinking around non-communicable diseases, communicable diseases. So for instance, if there's a place that doesn't have funding, they'll create an advocacy and awareness to ensure that they get more people to understand that there's no fund in this place. There's a big issue here, and we need to work around or solve this problem. So also do diet control and elimination. So think about polio, for instance, malaria, tuberculosis. They do all of those direct disease control and elimination. They also help with emergency response. So for instance, there are conflicts, there are disasters, there are organizations that work in that space to ensure that this disaster does not repeat itself again. And how can we ameliorate the impact of those disasters that have occurred? They also help with policy, like I mentioned, research, innovation, monitoring and evaluation as well, or accountability and partnership. So these are a line list of many contributions that these organizations play within the global health space. So now let's go into career path, right? So what are the career paths that exist? There are several, and I'll mention a few of them, and I'll mention this roles. So whenever you see those things on social media, then this person's working in that space. So for instance, if I pick health policy and advocacy, that's a career path. Some people are well suited for policy making and advocacy. That's their job, right? They can, write policy briefs. They can really ginger or push a lot of these briefs to ensure that it gets to the right table, and there are, adjudications regarding those policies to ensure that they are passed as laws. So there are people that are called health policy analysts, advocacy specialists, policy advisors. So this is a critical career path that exists within global health. We have people that are core program implementers. If you give them a project, they can handle your funds and implement projects to your satisfaction. So you keep on hearing people that are program managers, project coordinators, implementation experts or specialists. That is that domain. They implement, they design project, they manage and monitor projects in certain areas. It can be immunization, it can be maternal health, depending, right? And we have some organizations that focus on this. So for example, USAID does most of the implementation, Save the Children and the likes. We have those that focus more on epidemiology, which is diseases, right? So diseases. And they track disease trends, analyze data and inform the public regarding what the trends are and how to prevent the outbreaks. So people in the areas of epidemiology are called epidemiologists. We have biostatisticians, we have data scientists. So these are people that are within the epid and data analysis space, right? We have those that are within the space of research, health system strengthening. And what they do is that they ensure that they strengthen the different health systems that exist within a country. It can be strengthening service delivery. It can be strengthening the financing of health. It can be strengthening the governance of health and the workforce. So there's several also minute spaces within the health system strengthening space. We have people that also develop careers and build careers within the humanitarian space. And these are humanitarian aid workers, emergency health workers, health coordinators for emergency, and they save lives during crisis. So you see them more suited in areas that are prone to danger or issues. So think around the countries that have major issues that we see in the media today. Those are well suited and they place themselves within those spaces to provide aid and relief to countries that are in need of aid. Then we have those that really love how to ensure that essential drugs, medicines, and supplies get to the last mile. And what am I talking about? I'm talking about supply chain experts or logisticians. They can understand how to quantify drugs, how to push the drugs from this manufacturer to the different countries, because most countries don't really manufacture their commodities. So For instance, I'll use an example of Nigeria. Nigeria, most times we do not manufacture commodities or drugs. We have to import. So there are people that are very good understanding the modalities of bringing a drug, a commodity, you know, let's say China or Germany down to Nigeria. From Nigeria at the seaports, you move it down to the state, from the state to the local government, to the district, to the house, to the household, to the beneficiaries. There are people that are core experts within this space and are called supply chain and logistician within global health. Now we have people that are just, focused on health financing. And I would say this, health financing and health economics is one big area in Africa that we don't have major key experts. So if you look at other domains or other pathway for health, you will see many people filling those spaces. But we lack or have adequate numbers of health financiers or health economists, So this is one pathway that I think if anyone really wants to be in demand moving forward and tap into this space. And these are people that design sustainable financing models and cost-effective health interventions. So whenever developing any health intervention, so let's say malaria intervention, you have to think around, is it cost-effective? Is it cost-efficient? Will it be sustainable moving forward? Because there's someone that is paying for whatever intervention you are deploying to a country. There's someone that's paying for it. But you as an health financial expert or economist, you understand the numbers, the money, the figures, and the to say, you know what, if we're going to take a vaccine from this place to this place, this is the amount that it will land, and this amount that the beneficiary will have to pay for it. So all of those numbers, some people are really within the space to ensure that is sustainable. Those figures are something that everyone can pay for moving forward because of the context of the country. Now, the final one I'll talk about are community engagement or social mobilization people. Now, these are experts that engage within one of the very interesting subset of the government or the economy, which is the community. And these are community health specialists. So what they do is they go into communities and their job is to ensure that there's better adoption of health promotion behaviors and practices. So why are we saying this? When you look at the structure of the health system and the people that have the highest burden of diseases, of challenges, that are low and middle income earners. So let me just say low income earners, for instance, and they are within the communities. So their health seeking behavior is not the very best. And so because of the reduced education status that they have, they don't take very informed choices. And now this community engagement specialists go into community education to some extent so that they can promote their own health by themselves. So they go into communities and adoption of health-seeking behaviors and practices within the communities. Now, I will now pivot to the skills that one needs to have in order to be placed very well in global health space. The first bucket is what I call the technical skill bucket. Now, if you recall, I mentioned a few things, which is, people are within the space of product management, monitoring and evaluation, health financing, digital health, supply chain. So you need to have all of these skills. It's a technical skill. So think around, how do you manage data to make informed decisions? Data analysis is important. You can't do anything within global health without having data to back up whatever thing you're doing. There must be data to get that decision, get that policy, project, anything. You need data. And so you must be able to understand data, analyze data to get insights to push whatever goal that you have. So data analysis is important. Monitoring and evaluation is also important. On what do I mean? Whenever you share, for instance, Global Fund invested 500 million into a country, a project, that money is for a particular goal and purpose. At the end of that implementation of the project, there is the evaluation to say, did this money actually solve this intervention? And how do you say categorically that yes, these funds were able to tackle the problem that was set for? Is you going into an evaluation and monitoring the project. So even before you go any project, actually, you are meant to monitor the project. So that's core capacity, that skill set, the technical skill. And the people that are called M&E experts, they understand numbers, they understand frameworks to ensure that the project is on course, is timely, is going to achieve the goal, the outcome that has been set, and the vision of that project. So we have people that are called M&E experts. The second one I would like to talk about is soft skills. You're in the area of development, right? And so aside from your technical hard skill that I just mentioned, there are soft skills that you must exhibit to clearly distinguish you as a top-tier global expert. First is communication. People keep on saying, or people usually say, people in global expert talk a lot. Yes, you need to talk and know how to talk. So you can be in a room with a governor, with a president, with a director, with a very senior person, or even your colleagues. How do you communicate with them effectively? How do you look at the room, read the room, the audience, and communicate in the language that you understand? So for instance, if I'm speaking to policymakers, there are things I would say that would make sense to them. Rather, if I'm speaking to implementers, there are things, or M&E expert, that there are ways I will communicate that will suit that level of audience. Right. So owning the core capacity to communicate is very, very essential and important. Now, how do you develop all these skills? One of the very first is know the rudiment of communication, and then just keep on talking. You will improve. You can take courses, you can have someone that can, evaluate you. You can do things on your own, or you can join some coaching clubs or academies. So for instance, we have some clubs that exist that are core for speaking communication. Toastmasters is one, JCI is another, Enactors, there's several. So you can look for them, join them, and over time you will see improvement in how you communicate and speak. The other aspect again of soft skill that I think I would like to talk about here is leadership. Typically, as you are in global health, you will get to a point that you will definitely lead directly or indirectly. You would have to lead. And when I mean lead, I don't mean leading with a title. You will lead indirectly. Even though you're not given an emblem or title, you will just lead. Because you're going to what? Manage people. You're going to manage teams. You're going to make decisions in very high pressure environments. So for instance, if myself, Kennedy, is placed in a conflict or crisis zone as a humanitarian worker, I need to know how to manage projects. I need to know how to take decisions in very high pressure environments. And so that leadership capacity or acumen would develop. And I need to start exhibiting it. That's a core competence that one needs to have. So soft skill. Now, the third on the list of soft skill, right, is cross-cultural competence. Cross-cultural competence. In global health, you will work with different people across different time zones, different continents, different tribes and races. And so you need to understand and be able to navigate diverse cultural nuances, social nuances, and political context. If you are in a room with certain people, because of their cultural nuances, you understand that this is the way they talk and react. And so it's not about you, it's about their lifestyle, the people, the way they are. So when you understand, so for instance, Nigerian, if I am to work in a rural community, let's say the southwest Nigeria, where predominantly they take respect as very integral and important. If I want a community, the first is I have to go and meet the chieftains there. And one of the cues that I've learned is you need to by prostrating, by bowing down. These are nuances, right? Now, it's different if I go to South Korea. I don't need to do all of that. I would still show the respect, but in a different fashion. It's different if I get to Germany. So if I've understood all of these things, it will enable me to thrive. The fourth critical soft skill you need to have is problem solving. Global health has so much of problems that you will solve problem every single day, even in your sleep. You will keep on solving problems. If they give you a project to implement, that project is a problem. They don't fund places that don't have problems. They will fund places that have problems. And in that problem you are solving, there are problems. So you have to have that innovative and creative ability to develop solutions, quick, fast solutions to complex challenges that you anticipate every single day. So your mind should start working as you think through into space, that your mind should be wired to, how do I solve this? How do I solve this? How do I solve this? Yeah, like on autopilot, problem solving every day. And one last one I forgot to add is negotiation. There are different kind of negotiations. There's the win-win, where you win and someone else's that you're engaging, it can be government, would win, or a partner. So let's say I want to collaborate with another organization. So there's partnership is a big thing in global health. You can't do it alone. You cannot. So what is the partnerships? If you hear Global Fund with WHO in partnership with this, is doing that. Yes, because everyone brings core competence to the table to solve a problem. So you have to always negotiate. You negotiate for how the project will work that will suit your organization. You will negotiate for the times that you guys would engage. Probably now you have routine weekly meetings, monthly meetings, and meetings. You will negotiate. You will negotiate with the donor. So you will always be negotiating. So that negotiation skill has to come out very strong in your bucket of skill sets, soft skills. How do you push somebody from telling you no to saying maybe and saying yes to you? That's a skill you need to have. The third bucket for in-demand skill is sector-specific knowledge, health policy, disease expertise, humanitarian response expertise. These are sector-specific knowledge. Now, for those people that are within the global health space, they can find themselves in these areas. For those that are entering, because you're entering as a start, you might not have domain or sector specific knowledge. That's fine. But as you grow up the ladder, you advance your career, you will definitely see yourself tilting towards a specific area. It can be health policy, health systems, that's the large buckets. And this includes, financing, system threatening, universal health coverage, all of those ones. If it's disease specific, or you're in probably expert in communicable diseases. So you think about COVID-19, hepatitis, TB, and the likes. Non-communicable diseases, we have the diabetes, the sickle cell, hypertension, yeah. And we have the last one is humanitarian response. Those are crisis people, that are managers of crisis. Right. Now, the fourth bucket is language and cultural skill. I've spoken about culture, but language is important. If you want to really have a good space within the global health space, global, you're working with different people, different continents, different spaces. You need to understand how to communicate with them. So I know someone, a very good friend of mine, she has the core ability to learn language fast. And she's proficient in 7 languages. She can speak Nigerian languages, she can speak French, and so for her, it was so easy to get jobs, like very nice, juicy jobs. Because when I'm looking for someone that can speak Swahili, she's there. Someone that speaks German, she's there. French is there. Amongst her own technical and soft skills that she has. So language is a very easy and interesting way to break some barriers in global health, entering spaces. Right. The last one is project management skill, how to manage projects, which I will quickly rush through this. Now, I'll be walking us through recruitment, application processes, what it entails, and the likes. So typically, you see either a call for an application or someone has made a referral but for your competence for a role. So even if someone has done that for you, you need to put in an application. So the first step is you ensuring that your documentation, resumes, cover letters are very specific to the role. I know many people, you can say a role right now and you will not take the time. You won't take time to read through the job description or what the role entails. You just send in an application. And at the end of the day, 2 weeks down the line, say, oh, sorry, and you feel bad. Sometimes you need to take that extra step. Not sometimes, every time actually. Take that extra step to read through it. And I just say, what does it say? Do I fit? If I fit, do I apply? Okay, yes, I'm going to apply. How do I apply? What would make me stand out from everybody? Very important. How do you stand out? Now, everyone or many people would love to work in international or global health spaces. Many people love that. But actually, oh, I work with the Global Fund. I work with WHO. I work with UNICEF. It's very prestigious. And so one opportunity, one role, you can have 1,000 people that have applied for that role. I remember during my time, when I was applying for one of the roles that I got, and over 1,000 people applied for it. So is that very, very competitive. So for you as a person, how do you structure and ensure that you stand out in your application? Your resume must stand out. Don't use the typical resume template. Use very, very detailed, good layout resume templates. Read the keywords that exist, that appear within that job description. Also shows, and it's within your own resume. Very important, because global health folks that do recruitments typically don't have time to read through CV. So they'll slot it into an ATS, automated tracking system. And those use keywords to get high fidelity resumes that are very good or that are more promising. So for instance, I don't know if you guys have experienced this, but you apply for a job right now, 1 hour after I say, I'm sorry. The truth is they've not taken the time to read through it. They just passed it through an ATS. And that ATS will prune it and look, okay, this CV does not have the keywords we're looking for. They'll just send you a rejection immediately. So that's the first step. Ensure that your documentations fit the bill. The second is once you apply and you are called for the next level of interviews, the possible thing you would find is either you are asked to do a case study, to have a coffee chat with HR or hiring manager, a phone chat, or a technical fitness assessment. Case studies, they'll give a case study and I want to see how that case study. It can be you develop something, PowerPoint presentation, do an assessment test, just to assess I do have that capacity to do the job. It can be a coffee chat where someone just calls you to say, hey, hi, I got your resume. I'd like to talk through your experiences. Would you want to share some of your experiences area? And you talk them through, and they decide if you are the right candidate that they're looking for. Similarly with phone chats, which is almost the same thing with technical fitness. It's almost like the case study where they give you something to actually do. Sometimes they would dial you in. They can say, okay, you know what, let's on a virtual call, right? And they tell you, share your screen. They give you a task on PowerPoint, on Excel, on something else, on some tool that you're very good at, and they'll see how you're working in real time. That's second level in many cases. Now, once you've passed stage or second step, you go to the third, where it's more of interviews, panel discussions, one-on-one interviews. And it can be interviews with the colleagues that you'll be working with in the office. It can be either the director, someone very senior, depending on the role you're applying for. Right. And typically, you would have 2 to 3 levels of health, almost standard. One is where you have a final interview where you've passed everything. The key decision maker, the top management person on that project you are going into, organization would have a chat with you with either the HR within that virtual meeting or physical meeting. And the goal is that they want to really see if that top person will like you. Everyone has liked you from day one, but that top person has not been there. So they want to see if top person would really like you. And if you've gone to that level, it means, yes, you have some capacity to be there. So that interview, most people many times do not take it very seriously. Some people take it, but many people do not take it. So they come just a bit unprepared. So at each stage, always come prepared, The final one is an offer. So they give an offer. Oh, congratulations, you've passed through the stage of an interview or assessment. We'd love to make an offer for this role. This is the terms of reference, all of those things. So that is the typical 5-level or step approach, Like I said again, all of this step is dependent on the role you're applying for and how big or small the organization is. This step you would see typically you would find it in a very big organization. But if the stage is like 2 or 3, that organization is probably not that big, or the role is not that like top, probably mid-level or entry-level role, where you just did 1 or 2 interviews and they feel like you're good and they make an offer, right? Now, I want us to have it at the back of our minds that the recruitment can be as quick as 1 month, depending on when you fill the role, and it can be as long as 6 months. Yes, don't be shocked. It's very possible. They can be trying to hire someone and they were having interviews depending on how big the role is, how big the organization is, for 6 months. So every 1 month you have something they are doing. And before they get back to you, it take 3 or 4 weeks for them to evaluate feedback and get back to you. So it's very possible. So prepare your minds that that's something that you should typically expect within the NGO or the international space. Now, where do you see these opportunities? We have job sites that you can see them, but more importantly, the work that the immense work that people do within the global health space, word of mouth is the fastest and the best way to get opportunities and networking events rather than job sites. And I'll explain. The work that people do in global health is so important, so technical, so critical that you want someone that is already top, someone that is a professional in that area. So you want someone that, you know, if I speak to this person, they can tell me this person is a top deal, and I can get that person in 1 month, 2 months. But if I put it in the job sites, every Tom, Dick, and Harry can apply. And it can give a nightmare to the recruiting or hiring manager, where you're not even sure who is good, who is not good. But if I use a word of mouth, I say, okay, I ask a friend, I need someone that's good in M&E. My friend knows that person and said, I'm recommending Mr. A, Mrs. B. I'm almost certain that my friend will not lie to me for sure. And that person will definitely be an expert in that field. All I need to do is do my due diligence, and I will evaluate that person with 1 or 2 interviews, and I'm done. Right. But again, you can still see some great opportunities on job sites, LinkedIn, Glassdoor, and the likes. But I want us all to invest so much in the word of mouth referral or networking. When you go out for events, you know, corporate events, can be a conference, can be a summit, try to invest. If you are looking for an opportunity, I know someone somewhere works in an organization that you know you love to get into, engage with them, say, okay, I have interest in this organization, I love to work there. Let me know if you have an opportunity. No, just reach out to me. Trust me, it's easier and faster, you know. So that's that. Now, there are other unconventional ways to land some jobs or very good career opportunities. And many people don't do this. Some people do, which is fine, but it takes some work and some boldness to do. And this is you sending out cold mails to organizations and hiring teams. I know that many a times people that work in global health or jobs opportunity global don't get advertised. They will rather you leverage word of mouth. So let's say my director tells me that there's a role that they're hoping to fill, and I should make some recommendations. And you unknowingly reach out to me and say, hey, Kendi, I'm looking for a role in this aspect. In mind, I'm making a connection. Okay, my boss just told me something, and you're looking for something. I can make a recommendation. I'll ask you, give me a CV, let me look at it. I'll even polish it for you. I'll tell you to, or I'll give you a tip on how to polish the CV. I plug you in. My boss will say, okay, since this recommendation came from Kendi, who's a top trusted person, I would schedule that person for an interview. It's much faster that way. So they would rather not share most of the opportunities out because of the time it takes to recruit. Yeah. Now, that's the typical unconventional way I will advise or recommend that we take. So get a list of companies, organizations, you know, people that work in these spaces, reach out to them, send cold mails to say, I don't know if you have opportunity available. I'm looking forward to. They might not have at that moment, but they'll keep you in mind and say, okay, this is someone that reached out to me Q4 last year looking for a role. and a role comes up in Q1 2025, I'll plug and play that person. And that role was never advertised. Moving on. Now, what are the competencies that you need to have in order to have a fulfilling career in the field of global health? What are those competencies that you need to have? First, always continue upskilling yourself. Take paid trainings, courses, because the field is always evolving over time. And you cannot be lagging behind because you feel, oh, you're there already, you want to build your capacity. That knowledge you have right now will be outdated in the next 2 weeks or 1 month. So always update your knowledge and technical capacity or skill sets. Now get a mentor and a sponsor. And let me explain. When you get into global health, it's a very interesting space where you need someone very senior that has that same similar technical ability you have to always pour into you. That person has been there, done that. It would give you expert opinion, perspective that will better your work and your career. So get a mentor. And that mentor can be in the same organization that you're working in, or that person can be in a different organization, probably still in global health. That person will give you a balanced perspective to your career. It's like having a father or a mother to say, okay, my child, my daughter, this is the path you take, this is what you need to do. Now, the sponsor that you should have is someone that works in your organization and has a status of senior management or leadership. So why do you need to have a sponsor? That person would always recommend you and place you in top spots during decision-making processes. That person would vouch for you and support you and mention your name. Now, in global health, it's corporate. It's a corporate organization. And so you need someone that will always fight for you when you're not there. Sponsors always progress faster in their careers. Third one, build vast networks. You need them. People that they recommend for leadership, top roles are those people that have vast career. Don't think they don't watch, they watch. Let's say I'm in a meeting, for instance, and your boss asks you, do you know someone in this area? And you're saying, I know this person, I know that person. They take note of it that this person is someone that has a good vast network that will be of value to me. And they recommend you for some top level roles and engagement. And you ascend the ladder. I'll wrap it up quickly. The fourth is become very indispensable by always creating value in wherever you go. Become indispensable by creating value in wherever you go. So in your role, ensure that you are the go-to person. If you are at I'll use a typical level, an associate level or a managerial level or an analyst level, for instance, ensure that every of your colleagues, your bosses, see you as valuable, indispensable, because you are always doing something to bring value to what they're doing. They're taking the work from them, like you're relieving them of work or stress. They will always recommend you and have you at the back of their minds. The fifth is maintain visibility of your work. Don't do work and say, don't worry, I've done my work. My work will speak well for you. Your work would never speak well. It will never. Someone will just easily take your work and say, I did that work. Let's say, for instance, you are given a task to engage with government to push a policy brief or something, or get them to sort of agree on something, which they will not be willing for a very long time. I did that work in a team. If you don't tell your line managers, your bosses, your directors that, yes, I was the one who led the team, who was able to convince I, not we. If you don't ensure that they see that you are visible and doing your work, someone else will take that credit and you will just be doing the work and someone taking the credit. Very easy. It's a corporate organization, it's a corporate setting. So to ensure that you maintain visibility, bottom down and bottom to top. Lastly, seek evaluation and feedback on how you work and interact with your colleagues. Make it a mandate that every 3 months, 6 months, 9 months, get the people you report to give you evaluation, to know if you are doing the work in the right manner, right? So it's very, very important. Last but not the least is what are the pros and cons of working in this space? The very first one is that you do very important work. You drive critical mission, you're trying to save lives, improve burden of diseases, improve health outcomes. It's very important work, trust me. And you feel gratified because, let's say, for instance, if I championed rolled back malaria to of malaria incidents and death in Africa or Nigeria, and 20 years down the line, we don't have any cases of malaria, I would say I led this work, I reduced the burden, I supported this. It's gratifying that you did your own quota to improve Africa or your country. So you do important work, it's very gratifying. You get to also work with very renowned institutions, and that pedigree adds to your portfolio, right? You get to also travel, and this is mundane, right? You get to travel a lot because you do global work. So you can be in Kenya today, you can be in Tanzania tomorrow, you can be in different places, you're meeting people, you're interacting more, you're gaining more insight into different cultures, you're eating good food, staying 5-star, 4-star hotels. It's quite fancy, so that's a mundane pro. And you get to have better incentives. When I mean incentives, like financial and non-financial incentives, because of the kind of work you do. Now, the con to it is that the work is so demanding and it can literally stress you a bit. So, as one of the rules of thumb, ensure that you balance and you maintain, good health. Even though you're working in global health, it can impact anything on your health. You're always traveling, you're not having to sleep, you're having meetings across different time zones. It can impact on your health and it can be demanding. So ensure you strike that balance, within your work. And at this point, I'll landing here. So thank you so much for listening to my long talk. And I'd like to hear questions, feedback from the session. Thank you so much. Yeah, feel free to unmute, speak, Yes, Ayira, I hope I got it. You have a question, please feel free to chime in.
Oh, good afternoon, Kende,
Hi,
right?
good afternoon. Yes, you got it, Kenny. Yes.
Okay. I sincerely want to appreciate